you seen any of these online yet?
I watched one. I don't remember which one it was. I didn't hear the foot tapping though.
Just got an alert saying Children's Pediatrics is live.
I'm your host, Shane Littleton, CEO of
Talking to us about Wrangling COVID. Today we're going to be talking about
Hi, everyone. Whether you're joining us live here on Facebook or you found us on YouTube, I would like to welcome our audience. This is our next video in our series we're calling Wrangling Parenthood, presented by Chisholm Trail Pediatrics. I'm your host, Shane Littleton, CEO of Chisholm Trail Pediatrics. I'm joined here today by our expert, Colleen Regan, one of our awesome nurse practitioners who's going to be talking to us about wrangling summer issues with kids. That's right, guys. Summer's already right around the corner. And we always have plenty of questions about what to do with these kiddos that are in the sun all day, where they're usually outside frequently. They will be doing things like swimming, going to camps, playing on playgrounds, running around in areas where they could fall or get stung by bugs. Whether you're a brand new parent of a newborn and this is your first summer with your child, or you have teenagers running wild, we're going to try and address some of these issues today. So welcome, Colleen.
Thank you.
Can you give us a little bit about your background and what makes you an expert in this arena?
Sure. So I have 9 years of pediatric nursing experience before I came here as a nurse practitioner. So that includes a couple years in Tulsa at a children's hospital, and then the remaining years at Children's Mercy in Kansas City. So I worked in the NICU and then in an older pediatric unit. So anywhere from brand new newborn babies all the way up to 18 and 19-year-olds. And I also worked as a summer nanny throughout high school and college. So lots of experience with little ones and all the way up to the rowdy teenagers.
All right, excellent. So you've been with kids in the sun before and during the summer months.
Yes.
All right. So one of the first things I know parents like myself always ask is, what do I do to protect my child's skin and prevent sunburns in the heat of the summer?
Absolutely. So the number one thing that you can do is to limit your sun exposure during the peak hours of 10 a.m. to 4 p.m., which is not a very popular opinion with teenagers because that's prime time for the pool. But that's also when it's going to be the hottest during the day and when the sun's rays are the strongest. So if you are outside during these times, if you can stay in a shaded area, whether that's under a patio, under a shade tree, that will help to decrease both your sun exposure and make it a little cooler for you. Tightly woven fabrics in your clothing are helpful to protect the sun's rays from hitting your skin. Cotton is a great option, and it's also really lightweight and breathable. If you can wear a hat, especially one with a wide brim to protect your face and the skin on your neck, that is awesome. And a good resource also is to be looking at the UV index on weather websites or apps on your phones and to check that daily.
So when the UV index is really high, maybe pick another day to go outside of the pool.
Pick another day to go outside. Lots of activities you can do indoors, away from the sun, and in air conditioning, such as going to the library, going to the movies, walking around shopping centers. You can get really creative.
All right. And what about sunscreen? At what age is it safe to apply sunscreen to your child? And then what SPF are we looking for?
Absolutely. Sunscreen is super, super, super important. So any infant over 6 months is good to wear sunscreen. The AAP, which is the American Academy of Pediatrics, recommends at least an SPF of 15. If you ask me, I will always tell you at least 30. Below 6 months, we want you to just keep your infants in the shade, protect them with clothing, whether that's long sleeves and pants or SPF clothing, both are great, and sun hats. I want you to apply your sunscreen at least 30 minutes before you go outside, and then reapply it every 2 hours while you're in the sun. And even on cloudy days when you don't see the sun, you can still get a sunburn, so please wear sunscreen every day.
So those UV rays are still coming down,
They're
right?
still coming.
All right. Well, what if I have a child that's younger than 6 months and there's no shade available? Is there any options?
Yes, you can put sunscreen on your infants younger than 6 months, just a small amount on their face and kind of on the backs of their hands, the parts of their skin that are most visible to the sun. Just make sure to keep it away from their eyes and then monitor for any skin reactions, just because their skin is so sensitive and permeable.
Okay. So what if the inevitable does happen and we try to prevent these sunburns, but they happen? So how do we do to treat a sunburn?
Absolutely. I am somewhat of an expert in this with my pale Irish skin.
All right.
You can always give Tylenol or Motrin for pain relief. Make sure you're hydrating really well, because that burn is going to suck the moisture right out of your skin. Aloe vera, whether that's from a bottle or from your aloe plant, is going to feel great on your skin. It's naturally cooling. There are also lots of lotions and creams available that are after sun creams. Anything that contains aloe is going to feel really good on your skin. I want you to stay out of the sun until that burn completely heals and fades, which is usually a few days, and your skin's no longer going to be red. If you need to seek medical attention for severe burns, you would see things like blistering, or your skin is weeping, which means there's like liquid coming out of your skin.
Okay. So you can use that as kind of a stick for the kids. Wear your sunscreen, because if you get sunburn, you're not going outside for a couple more days.
You have to go
No
see,
more pool time.
You have to go see the mean doctor.
Yeah. Speaking of, let's talk about swimming. Obviously, that's the most popular activity to do in the summer for the kids. What are some general guidelines for water safety?
Absolutely. I really, really, really recommend, if you're going to be around a pool, whether it's the public pool at your in-laws and a family members, really encourage that person to have a fence around the pool with 4 sides of the fence and a gate, a childproof lock on the gate. These fenced-in pools have shown to reduce the risk of drowning in children under 4 years old by up to 80%. So it's super important to have that body of water really enclosed and safe from children. If you are going to be around a body of water or a pool, make sure that your child is always within an arm's reach of you, and make sure an adult always has eyes on the child. An easy way to do this, if you're in a large crowd of people, is to take turns and rotate through, like every 15 to 20 minutes, who has eyes on all the children. Make sure they're using flotation devices in the pool if they're not strong enough to swim on their own. And for you older kids and teenagers, even though it doesn't sound cool, I would like you to always let an adult know when you are getting in the water and when you're going to be around the water, just in case an accident happens. If you're going to be on a large body of water, such as an ocean or a lake, I want you to have a life jacket on. And this also goes for if you're in a boat or on a jet ski, even if you're just sitting there, I really want you wearing your life jacket.
And local laws are actually going to require that, especially around the lakes around here.
Perfect.
I think if you're 13 and under, you're required to wear a jacket at all times when you're on a boat. All right, so obviously we want to focus on safety, but we also want to teach the skill to our kids to be able to independently swim. What age do we start swimming lessons?
So it's a little different for every kid, and parents, you can kind of gauge your child's readiness or gauge it depending on how often you're going to be around the water. Some families have pools in their backyard, some are lake rats, some go to the beach a lot. So really it depends on your level of comfort with this. But anytime between the age of 1 and 4, kids generally become ready on their own for swim lessons. But again, each kid will be ready at different ages, and that goes with siblings too. So just because older brother or sister started at 1, younger ones may not be ready at that age too. So be a little lenient with that. But classes that include both parents and children are a great way to introduce your child to the water safety and swimming. They'll feel a lot more comfortable with you there. By the age of 4, most kids are usually ready to start those swim lessons.
All right, excellent. Yeah, I know we've done swim lessons with both of our kids at a young age, and it's nice just to teach the skill. My daughter, at the age of 2, could find the edge, and she would be in there with her mother and learning those type of skills, just survival and safety skills.
It makes you feel a little more relaxed.
It really does, because accidents always happen. What about infants? Are we going to give swimming lessons to infants?
So the AAP does not recommend infant swimming lessons, as they are not proven to reduce the risk of drowning. But we strongly encourage, and so does the AAP, water play classes. So this can be with mom or dad or whatever caretaker is in the infant's life, just to get them used to the water, kind of sensory play. So it's not as shocking when they actually do start swimming lessons.
All right. And also, you don't want them to be afraid of the water and have that phobia, get them used to it, but be safe. I always hear around the office swimmer's ear.
Yes.
Where does that come from? What does that look like?
So what it looks like on kids, their ear is going to be painful. So it is actually the ear canal and the outer part of the ear that becomes infected. It's going to be really red. It might be swollen. It might be itchy, but it's going to be painful. So to press on any part of the outer ear is going to be really painful for them. And we would want you to come into the office for any of these symptoms for them to be seen.
Okay. All right. Excellent. And what about eye irritation? I know a lot of those public pools have a lot of chlorine, and you see these kids with just bright red eyes. What are some things we can do about that?
So that's not something that you would need to come into the office for to see us, but if you want to, we absolutely are happy to accommodate that. It's going to feel like a burning sensation, and their eyes will probably become pretty red. They may be swollen and they'll be watery, but if you can just rinse their eyes with fresh water immediately after it happens, and then you may need to continue doing that throughout the day, that's sufficient for rinsing the chlorine out.
Excellent. All right. So we are in Central Texas, and we're used to 100-degree days, especially in the summer. It's going to be hot this summer specifically. Let's talk about heat safety.
Yes.
And things to watch out for as far as heat exhaustion and things like that. What are some safety precautions and general tips just for being outside in this hot summer heat?
Absolutely. Number 1, never, ever, ever leave a child of any age in the car in the heat for any period of time, no matter how short it is. Extreme heat is classified as over 90 degrees. So here in Central Texas, basically every day of the summer. So things you can do when you're outside, and honestly, just living your life in this heat, stay hydrated. So make sure you always have plenty of water. Take what you think you need and then some. Drink it frequently throughout the day, especially with young kids. If you can take just small sips throughout the day, that helps to keep them hydrated. And then plan for frequent rest breaks throughout whatever activity you're doing, because kids will tire easily in the heat, and so will parents and caretakers. Wearing loose-fitting clothing and breathable clothing will help to keep you a little cooler, and then limiting your time outside during extreme heat.
All right. What are some warning signs to watch out for in the heat?
So feeling dizzy or faint or extremely tired are both really big warning signs that we would want you to either come into the office or go to the emergency department to seek medical attention. Headache and extreme thirst, nausea or vomiting, breathing at a really fast rate, and then having muscle aches or spasms are all very concerning factors for heat exhaustion. Also, if your child becomes dehydrated and has not urinated for several hours, so in an older child using the bathroom and a younger child, if they're having less than 4 wet diapers a day, we get really concerned for dehydration.
So if you see any of those signs, call somebody, whether it's us or the emergency room, like you said. Act and do something about it, parents. All right, school's out. The kids are ready to play. Let's talk about some common injuries that happen because now they're running around on playgrounds or playing with their friends and they're doing other things. How do we prevent them?
Number 1, I want you to wear a helmet. I tell my patients this every single day, but now that we're out for the summer, you're riding your scooters, you're riding your bikes, you may be on an ATV, you may be rollerblading. I don't know if that's still popular, but I want you to wear a helmet for any wheeled activities and any motorized activities to protect both your head and your brain. I know it's not cool looking, but they're making lots of different styles of helmets. So whatever you like, you can probably find something that looks cool. Other things that kids come in for, scrapes, lacerations, if you can just clean those with soap and water if they're shallow, and then just keep like a triple antibiotic ointment on it, such as Neosporin, you are good to go. Any sprains, like rolling your ankle, common injuries from falling at the playground, we are happy to see you in the office. If it's a little bit of a lag time before we can see you, you can always follow the RICE acronym, which is rest, ice, compression, and elevation of the affected area on your body where the injury is.
Definitely done that plenty of time in my day. Big sports family, my kids. All right. Other things that happen in the summer that we see, bug bites and rashes.
Yes.
What can my child do to prevent this? Can they wear bug spray? Can the bug spray have DEET in it?
Yes. So I highly recommend bug spray when you're outside. It's going to protect you from mosquitoes, sugars, biting flies, ticks, everything that's flying around in the air and going to bite you. So any infant over the age of 2 months can wear bug spray, and that bug spray can contain DEET or picaridin. So like I said, it's helpful to repel ticks, mosquitoes, chiggers, fleas, and flies. And anytime you're outside, I would recommend wearing that because it's going to prevent less pain and itching later on.
Yeah, and some of those houseflies do bite. I've
hurt.
learned that recently.
Yeah.
Yeah. What are some common types of bites and what can be done about them?
Absolutely. So for your itchy bug bites like mosquitoes, fleas, and chiggers, you can use over-the-counter hydrocortisone cream or Benadryl cream to help relieve itching and any inflammation from the bite. If your bite becomes really red, really swollen, it's growing really fast, or if you notice like an oozing from the bug bite, we want to see you in the office just to make sure it's not infected. If you're stung by a bee, a wasp, or a hornet, know that it's probably going to hurt pretty badly at the site. It's normal for it to swell a little bit. Cool compresses, such as like an ice pack or a cold washcloth, are going to help relieve that pain. Things we want you to seek medical attention for immediately at the ER if you go into anaphylaxis, which is extreme allergic reaction, swelling of your mouth, swelling of your throat, difficulty breathing. We want you to call 911.
Right. Okay. And what about ticks? I know we have a lot of forested areas kind of around here, especially if you're around the lake.
Yes.
When should we check for ticks?
I want you to check for ticks anytime you're in a wooded area or any area with tall grass, because ticks can live in any of those places. It's a little embarrassing for older kids to have their parents check, but I want you to check your entire body. So in your underwear lines, under your bra lines, all the nooks and crannies on your body. Ticks like really warm, dark places. So I want you to check your whole body.
Okay.
If you do find a tick and you are removing it at home, please make sure the entire tick is removed. Sometimes their little heads like to get stuck in your skin. So make sure the entire tick comes out.
Great. And what about things like poison ivy and poison oak?
Yes. So try to avoid it, but inevitably you're probably going to find some over the summer. The oils from the plants are what cause the rash to spread over your body. So if you are touching one part of your body and touch another part, the transfer of the oil is what causes the rash to spread. So I want you to wash your body immediately if you know you've been in contact with it. Make sure to wash any and all clothing and towels as well, because the oils can stick to those. Oatmeal baths and cool compresses, such as a washcloth or an ice pack, will help with symptom relief. If your rash is mild, just limited to a small part of your body, you can apply calamine lotion 3 to 4 times a day. You can use hydrocortisone to kind of help decrease the inflammation from the rash. But if the rash is widespread, or if it spreads to your face or your private areas, we want you to be seen in the office because you may need steroids to help kind of calm that area down.
I remember all that pink lotion from all the
Yes.
poison ivy back in the summer camps.
Yes.
So Obviously, we're in Central Texas. We have a lot of allergy issues right now. Oak is going ridiculous. But what about summer-specific allergies? What do you suggest?
So moving into summer, we're moving from the oak allergies to all the grasses. So basically everything outside. So symptoms of allergies can include a cough, a runny nose, itchy eyes, itchy throat, lots of sneezing, or like the clearing of the throat. Especially when they wake up in the morning as that drainage starts to go down into their throat. A lot of that throat clearing will happen. So if you know that this is a trigger season for your child, I recommend taking a daily antihistamine, such as Claritin or Zyrtec. Some people will take Xyzal, and we want you to take it every day throughout the season to reach the maximum efficacy. If you're unsure about the dosing for your child's weight, feel free to call us in the office. We are more than happy to help you guys out.
Excellent. All right. Great information there. We also have some questions from our viewers. Any thoughts on summer camps and COVID risk this summer? We've had a lot of COVID podcasts, and I suggest our viewers go check out those from last year with Dr. Kavanaugh. But what about COVID and this summer with camps and all these kids grouping?
I agree with you about looking at our previous podcasts on COVID. First and foremost, it's up to parents and your comfort level with sending your child to a summer camp. I believe that all of the summer camps and kind of like group activities that are going on in the state have to follow the most up-to-date regulations and recommendations from the CDC. Frequent hand washing is great. If you are comfortable having your child wear a mask, that's totally fine. But bottom line, it's parents' comfort
Right.
and how you guys feel about that.
Right. I know we haven't had a whole lot of COVID cases in the office lately.
We've been seeing hardly none.
Yeah,
So,
hopefully that's
yeah.
good signs of good things to come. I do know that's super important for kids to be active and be social and be with friends, as long as you're taking all the precautions that we
Yeah.
just spent the last 20 minutes talking about.
yeah. And at this time, after the past 2 years, like for cases to be so low, it's awesome for them to get out and see
Yeah,
their friends and
absolutely.
be a kid again.
Big time. All right. So next month, we're actually going to be having another podcast with one of our specialists, Dr. Kevin Tahiri. He is a local ENT, and we're going to be talking about all things pediatrics in the ENT world. So please tune in for that. That's all the time we have for today. I want to thank everybody for listening in. Special thanks to Colleen for all the great information that she gave us this evening. Thank you to Chisholm Trail Pediatrics and our producer, Emily Littleton, who put all this together for us. If you've enjoyed what we saw today, please give us a thumbs up or hit that like button to support us. If you would like to schedule an appointment for your children and come in to see one of our awesome providers like Colleen here, please be sure to give us a call to one of our branches and set that up. Also, be sure to check out our Facebook page and our website to find more about Chisholm Trail Pediatrics. All the information will be available for you in the details of the show. We have some really cool things coming up. We are expanding our Round Rock branch where you will be next year. We're building our own building, and we're also opening up a Liberty Hill branch that will be opening up this fall, featuring Dr. Francesca Estrada, a very talented and well-known pediatrician that's been in the area for 15 years, and that'll be again this fall. So we're all really, really excited. Well, thank you again, Colleen. Thank you to everybody for listening in. Until next time, please stay safe, and I hope you have a fun summer.